Hello our viewers, you're welcome once again to our platform Health Tips and Tricks. I am Dr. Andrew, your physician, to take you through some of the important aspects of your health. Today we are going to talk about something which is very common, something known high blood pressure. Previously we talked about the heart in our previous video. For those who missed it, feel free to download and catch up with our video about heart attack. So in this video, we are going to talk about high blood pressure. If you like our channel, please feel free to subscribe and also give us a like below, and feel free to put any comments in the section below. Without further ado, I will go straight to the question concern from our viewer. She says, "Hello, I'm Angelo, a 53-year-old housewife from Catalonia, Spain. I was diagnosed with high blood pressure and started on medication, but my blood pressure is not going down. What could be the problem? Could there be something else that I may not have known? What should I do, doctor? I am so worried." So before diving into this, I'll first try to help you understand what high blood pressure is. So what is this thing called high blood pressure? So like we said, the high blood pressure is the pressure of the blood which is moving in your blood vessels within your body. To make this more clear, I will use an illustration. So the heart is an organ in the body which pumps blood to the rest of the body organs, to the muscles, to the brain, to the lungs, to the kidneys. All your body depends on the heart to function. And the heart has to push blood to these body organs through what we call blood vessels. Vessels like pipes which bring the blood. So we have the heart here. Then we have, I will just use some few body organs. We have the lungs. We have a kidney here. And maybe a muscle. So what is the heart doing? The heart has pipes called blood vessels. One brings blood to the kidneys, it has blood coming to the lungs, and it has blood coming to the muscles. So these are the blood vessels and all the other body organs. Blood coming from the heart going to them. So as blood is moving through these pipes, the heart is pushing it to the different organs. And as the heart is doing this, it is doing work against a certain load. What is the load? The load is being able to push the blood to this organ, being able to push the blood to the lungs, to the kidneys. In doing this, it is working against a certain load. So that load it works against is what builds up the pressure inside the blood vessel. Within the blood vessel, that's the pressure which builds up. Now, for your body to function efficiently, the blood has to move from the heart to go to the organs. So it means your pressure, your blood pressure, the pressure of the blood within the vessels should be within a certain normal range so that your heart doesn't have to do a lot of work in order to push the blood and oxygen to your different organs. Now, when you have high blood pressure, it means for some reason or one reason or another, the pressure within these blood vessels has gone up. What does that mean? That means the heart has to work against a heavy load. It has to push blood against a bigger pressure, against a high pressure. And in doing that, it means blood may not be efficiently pushed to your organs. And what does that mean? That means the heart will, because of doing a lot of work, it will fatigue after some time. It's like if you are told to push against a wall which can't move. You'll push and push and push, and after some time you'll get fatigued and you'll tire out. That's the same thing which happens to your heart if your blood pressure is very high, or if it is high. The heart will be doing a lot of work and it will get fatigued and you get heart damage and heart disease. Okay? So having understood that, we now go to the topic of high blood pressure, having understood what it is in simple terms. So how does someone get high blood pressure? We can begin from there. So like we said, the pressure in your blood vessels increases and your heart has to do a lot of work in order to give blood and oxygen to different parts of your body. So what are some of the things that can cause this? One, to begin with, age. The more you grow, the more your blood vessels become also aged and sickly. If you look at a person who is old and you look at their skin, you'll see their blood vessels, they will be bending around. They have grown old. The blood vessels are old and they have become kinky. So when the blood vessels become old, it means they become a bit narrower and less flexible. So they are not able to bring blood efficiently to the different body parts. Why? Because they are narrowed and the heart has to do more work to push blood through them. So that can cause high blood pressure. And that's why all of us have to be vigilant. When you reach an age which is advanced, maybe we can say 40 years and above, we need to constantly go to our physician and have our blood pressure measured. Why is this important? Because as we shall see, blood pressure does not have any outstanding symptoms. You will not feel pain and say, okay, I'm feeling pain, let me go and see my physician. No, that may not happen for you. And by the time you see your physician, it might be too late for you when you have already developed high blood pressure. What are some of the other things which can cause high blood pressure? Previously in our video, we talked about some of the risk factors for heart attack. And these are come again. There are still, some of them are still the same. For example, an unhealthy lifestyle. Things like smoking. Smoking will cause your blood vessels to become damaged. Once the blood vessels damaged, they cannot bring blood efficiently. So the heart has to do a lot of work, and that will be the high blood pressure. Diet, the kind of food we eat. If you eat food which has a lot of fat, this fat from animals will deposit in your blood vessels, make them narrow, and will increase your pressure because the heart has to do more work in order for the blood to reach the different organs. So your blood pressure goes up. And some other things like genetics. In some families, they have certain parts of their genetics which lead to predisposition to blood pressure. And also, as we go further with this question, we shall look at some other causes. So those are some of the common causes. However, we can also have other different causes. For example, a high salt intake. If you go to diet, high salt intake, for example, that's why some of you could be having relatives who have blood pressure, and their physician has told them to reduce their salt intake. If you take in a lot of salt, what happens? Salt will pull water with it. Salt always moves with water. Because if an area has a lot of salt, water will come there. Water will go there. For some of you who remember your primary school science, you studied something called osmosis. Water moves from one area to another. So water tends to follow salt. So if you take in a lot of salt, water will follow the salt. So you'll have more water in your blood. And if you have more water in your blood, it means you'll have a lot of blood volume. And that will also lead you to have high blood pressure. What are some of the other things? There are also certain organs in our body which get damaged by one thing or another, and they also cause an increase in blood pressure. For example, the kidneys. Some of us can be having kidney disease, which again comes from different things, and hopefully we shall have a video on kidney disease. So when the kidneys get sick, your blood pressure can also go up. We have something called an organ in the body called the thyroid gland. What is the thyroid gland? Some of you know in our body we have different organs called glands. These glands produce certain substances that help our body to function very well. One of them is located at the neck. At the neck. Some of you could be having relatives who have suffered from something called goiter and they have a swelling on their neck. So that gland there, that organ which is there is called the thyroid. This thyroid sometimes can also become sick, become damaged, and it can also make your blood pressure to increase. We have the lungs. The lungs can get damaged because of different things, and they can also cause your blood pressure to go up. So different organs in the body can also get diseased, they can get sick, and they can also cause your blood pressure to go up. Yeah, so when you get a high blood pressure, how can you realize that you have a high blood pressure? So, like I said earlier, high blood pressure is not painful. So many times it goes unrecognized. We as patients, I as a patient may not be able to tell because I don't have any pain. However, there are some warning signs that we can experience in our lives. For example, you get constant headaches. All the time you're having a headache. This could be a sign that you've developed high blood pressure, and it would be good for you to visit your physician and have your blood pressure measured. Number two, we could have maybe you do a small activity and you feel very tired. Maybe as you're walking and standing for some time, you feel dizzy. You feel like you want to fall. Alternatively, you could be when your heart beats very fast. Maybe you're just seated, you're not even doing anything, and your heart is beating very fast, as if you're from running a marathon. So when all these things happen, these should be warning signs to us to show that we need to go to our physician and have our blood pressure measured, because these are some of the warning signs we can get. So when you go to your physician, they measure your blood pressure and it is high. What next? They will start you on medication, depending on how high your blood pressure is. Sometimes they could start you on medication. They could also tell you to adjust certain things in your lifestyle, maybe your diet, maybe lifestyle, maybe smoking cessation, start doing exercises, and these could be some of the additional things which they will have you do. And on occasion, start you on 1 or 2 drugs to control your blood pressure. Because like we said, if your blood pressure is high, then it means your heart will have to do a lot. It will have to work a lot in order to make sure that blood reaches your different body parts. And because the heart is working a lot, it will finally get fatigued and you get heart disease and heart damage. So in order to avoid this, the blood pressure needs to be treated and lowered so that you don't get heart disease. And that is why your physician will start you on a drug or 2 and some other lifestyle modifications in order to lower your blood pressure. So, but in certain scenarios, like our friend here from Spain, they will start you on that medication and your blood pressure refuses to go down. Your blood pressure is not going down. So what could be some of the reasons why your blood pressure is not going down? Like we said, a blood pressure has certain causes. So different causes of blood pressure need to be treated differently. And that's why if you go to your physician will ask you certain questions. Do you do this? What kind of food do you eat? Do you take a lot of salt? Do you have social problems? By the way, one other thing we forgot which can also give you high blood pressure is social issues. For example, social stressors. Maybe you have been fired from your job and you don't have a job, yet you have a family to feed. Maybe your wife has left you and you have a lot of stress. So all these things can also cause the blood pressure to go up. Anxiety. You are worried about very many things. You're worried about this, you're worried about this, you're worried about school fees, you're worried about your children at home. So all this can also build up and cause what we call anxiety and stress. And how will your body respond? Your body will respond by producing certain things in the body. We call them hormones. And some of these hormones will make your blood pressure to go up. So depending on what is causing your blood pressure or what is predisposing you to your blood pressure, the drugs are chosen. So if your physician asks you what could be causing your blood pressure, and then it is identified, this is what will be used to choose for you a drug to treat your high blood pressure. But sometimes we can start medication maybe without seeing a physician, or sometimes you don't tell the physician your story, some of the things, and he's unable to know what could be causing your blood pressure. And when this happens, we just start drugs randomly, and these drugs may not be of help to us. For example, if your blood pressure is because of social problems, you're having social stressors and anxiety, there are particular drugs which will work on you, and those are the ones that are supposed to be used. If you are given certain other drugs, then they may not help you. Blood pressure has quite a number of drugs which are used to treat it. But each drug treats a certain part of the body, treats a certain mechanism or a certain way which has brought about the high blood pressure. If your high blood pressure is because the kidneys are sick, and then you are given drugs which don't work in that line, then your blood pressure will not go down. If your blood pressure has come about because of age, and then the physician is not able to target the drugs he's giving to that particular line of causality, then the drugs will not benefit you. So that could be what is happening with our friend here, who had a high blood pressure and started the medication, but the blood pressure is not dropping. So if that happens, then you need to visit your physician. And your physician has to ask you certain questions and also carry out certain tests. For example, they could test your kidneys and see, are the kidneys functioning well? They could test your thyroid gland, we talked about it, is it functioning well? We could also test and see the salt levels in your blood. Do you have a lot of salt in your blood? Or is the salt level very low? And all these will help the physician to say, okay, depending on what we have seen, this drug is the one which will work for you, and this one will not work for you. And that would help to lower your blood pressure because we have something we are targeting as a causality of your high blood pressure. But regardless, that could all be done and we still have your blood pressure persistently remaining up. So that brings me to something we call resistant blood pressure. There is blood pressure which is resistant. You do all this, you treat this, treat different causes, and your blood pressure is still not going down. So if you are a special kind of patient and you have what we call resistant blood pressure, then you still again need now further care from the physician. So this is the time when you also bring in other specialists to see you who are specialists in treating blood pressure. And we shall now start bringing in other drugs which are special drugs for treating resistant high blood pressure. And with all this, together with the lifestyle modification we talked about, like exercises, weight loss, having an improved and healthy diet, of course including mostly plant products and less of animal products, and also a healthy lifestyle, refraining from smoking, heavy alcohol drinking, and all this will, together with the effort from different specialists and physicians, it will probably help to lower your blood pressure, and this will protect you from further complications. And of course, yes, if your blood pressure is persistently high, yes, you should be worried because like we said, this will make your heart become sick and you can end up getting heart disease, even heart attack and heart failure. So when your blood pressure is persistently high, you should be worried, and that's an indication that you should visit your physician to bring in some of these other treatments and modifications of treatment that we have talked about. In a nutshell, high blood pressure is not good to have, and it may not warn you. So if you identify any early sign, or you go to see your physician or your doctor and your blood pressure is high, then it needs to be treated. And as the blood pressure is being treated, you need to constantly be monitored by your doctor or your physician, because blood pressure can become low, it can become high, it can become resistant at any point in treatment. And that's why it is not good to just take medication, but continue seeing your physician and they continue guiding you on how to take the medication, how to adjust accordingly. And also, of course, the lifestyle modifications we have talked about. So I hope that brief response answers the question, and I hope we have all been able to learn something new about high blood pressure, some of the things that can cause it, how we can prevent it, and when we get it, how we should get treatment. If it becomes resistant and it's remaining high, what we should do in order to get treatment for it to be lowered. Thank you for your attention. If you like our video, please subscribe and also give a like. And if you have any questions and comments and you want to learn more, feel free to comment in the section below.